Yeah, so I wanted to continue with talking about cancer and how mutations occur. I'm sorry about the cold. I've had a cold all this week, so I sound a little gravelly. We were talking about caretaker genes, and like you said, the loss of these genes lead to increased mutations. And this chromosome instability appears to be increased in malignant cells. Um, it can be caused by malfunctions in the um, pieces of the cell that regulate chromosomal mitosis. It results in a high rate of chromosomal loss, um, a loss of differentiation, a loss of chromosomal amplification, and these events can accelerate, so causing many mutations in a network of genes. Genetic events are the basis of cancer, and I would say the number one basis. Frequent genetic changes are increased by exposure to different mutagens or agent causing mutations and defects in DNA, and the defects in the repair of DNA, like the loss of the caretaker gene function, like so many different causes, ultraviolet light, smoking, and the things that are discussed in the chapter 13. And when these genetic events occur in somatic cells as opposed to germ cells, the event is not inherited, but it's possible to occur in germ cells, mostly in tumor suppressor cells, even though this is pretty rare. So multiple genetic hits are required for cancers to develop. So what genes are involved? Basically, the specific pathways have to be dysregulated for cancer to occur, and cancers have to have many mutations to proliferate without any type of anti-growth checks and balances. And different types of cancer have mutations that enable them to proliferate without, in the absence of external growth signals. Sometimes we have growth factors that are secreted that increase the cancer division. Then we have an increase in growth factor receptors. Sometimes there's mutations in the signal from the cell membrane surface to the nucleus. There's mutations in intercellular signaling. There's inactivation of different types of tumor suppressor cells, which usually have that are turned off, and usually these tumor suppressor cells are anti-growth cells, or activation of protein kinases that drive the cell cycle and so facilitate growth within the cancer cell. And like I said, there's different a decrease in apoptosis signals, and so there's not a lifespan to the cell. Angiogenesis helps cancer cell growth in that there's new vessels, so supplies it with nutrients, and advanced cancers seem to secrete angiogenic factors to facilitate the feeding of the tumor. Like I mentioned, the VEGF, the vascular endothelial growth factor, so they're very specific to different tissues. The PDGF, platelet-derived growth factor, and there's many of them. And cancer cells, like I said, are immortal. Body cells aren't immortal. They have a definite time span and limit to them. And like you said, the telomeres are the protective caps on the chromosome that are held in place by the enzyme telomerase. And the telomeres eventually become smaller and smaller, and then causing the cell to not divide as frequently and then to die. And cancer cells can activate the telomeres, leaving leading to continued division. What's the relationship between immunity and cancer? Well, an efficient immune system can suppress many malignancies, but there's usually defects in the immune system, and they have increased risk of viral-associated cancers as a result. Then, in terms of treatment, as a result of this knowledge, we've used immunotherapy as a treatment. It can be active or passive. Immunotherapy actively is an immunization with tumor antigens to elicit the immune response against the cancer. Passively, you're injecting the patient with the cancer antibodies or lymphocytes, which are directed against the antigens. We have several, like you said, viral-associated tumors, like Epstein-Barr virus can lead to the development of B-cell lymphomas. Another example would be the Kaposi's sarcoma. Herpes virus can occur in a more virulent form in individuals who are immunosuppressed, especially those who have AIDS. Or another example is the human papillovirus is implicated in cervical cancers. And then another one is chronic hepatitis B infections can lead to liver cancer. There's also a relationship between inflammation, especially chronic inflammation that has occurred over a period of time, and cancer. Chronic inflammation is an important factor, and the active inflammation predisposes the person to cancer. And susceptible organs are the GI tract and pancreas, thyroid, prostate, urinary bladder, and skin. And the inflammatory cells release compounds as reactive oxygen species that promote mutations and block the repair processes like your caretaker genes when DNA are damaged. And an example of inflammation predisposing to cancer would be ulcerative colitis. When you've had it for 10 years or more, you have a 30-fold increase in developing colon cancer, an increase in lung cancer among persons with chronic asthma. The chronic infections associated with the peptic ulcer with H. pylori can lead to different types of stomach carcinoma or tissue lymphomas. And then certainly there's a tumor-associated macrophage is the key cell that promotes tumor survival, or one key cell, and it develops the capacity to block cytotic T cells and natural killer cell functions, and it secretes growth factors, thereby promoting cancer growth. And many tumors produce their own chemotactic factors and stimulate macrophages, in this particular tumor-associated macrophage, to the area. And these also secrete, so instead of taking care of the antigens and the abnormal cells, they're promoting the growth and secreting angiogenic types of factors and promoting new vascular growth as well. Metastases, you should know this from your baccalaureate education, certainly spreads to different tissues, invades, survives, and proliferates in a new environment, and then promotes new cell growth. And we look at the clinical manifestations of cancer by diagnosing and staging it. Stages involves the size of the tumor and the degree to which it's invaded and the extent of the spread. And then we also look at, in terms of many different clinical manifestation, pain. There's usually little or no pain in the early stages of malignancy. It's a late stage of cancer, from pressure, obstruction, stretching of tissues, tissue destruction, inflammation. Fatigue is the most widely reported, and it can cause sleep disturbances, biochemical changes to the disease and the treatment, involving difficulty with nutrition, too tired to eat, difficulty in terms of psychosocial response to the treatment. Cachexia is another clinical manifestation, anemia, leukopenia, thrombocytopenia, infections, hair loss, alopecia, and different types of treatment, of course, are based on the type of tumor and what's best for the patient. Chemotherapy, radiotherapy, surgery, or a combination of those modalities, and certainly alternate therapies like managing pain. And so basically, I want to conclude by saying a few thoughts about childhood cancers. Most adult cancers involve the epithelial tissues, where childhood cancers involve usually connective tissue, nervous tissue, and hematopoietic tissues. Usually inheritable forms of cancer have an early onset and a high frequency in one organ or bilateral involvement. Early diagnosis in children with cancer is usually overlooked, since many of them mimic so many childhood disorders. And treatment certainly usually is started for most people in the later stages because of the problem with diagnosis. And treatment as children also has problems later on and can recur in terms of impaired growth, cognitive dysfunction, and hormonal dysfunctions as a result with survivors. And they can have difficulties later on with those different problems. Also, cardiomyopathy can be a problem, pulmonary fibrosis, and a risk for other kinds of cancers can occur in children of survivors of one type of cancer. So those are just a few thoughts about childhood cancer. Certainly, you want to look over the other chapters. There's more detail there, but that's just a quick overview.